Hi there, it's Dr. Daniel Hockenberry over at Ried Physical Therapy. So today we're going to be going over some more frequently asked questions. One of them being, I have arthritis, how can physical therapy help with that? And today it's going to be regarding the knee. So arthritis is just defined by inflammation that actually is occurring in one or more joint of the joints of the body. So that being said, things such as arthritis are kind of sometimes can turn into a chronic condition. And the way that physical therapy can help that is as we actually start to build more strength and stability around the joint itself. So in this case, a knee will actually decrease the amount of shearing and compressive forces that actually are pushed through that knee and are able to help that joint contact. We can't change that if there is some chronic arthritis or some damage in that area. That's one thing we don't fix. But what we can do is fix how the knee is moving and how smoothly it moves. There's actually other techniques such as mobility, again, strengthening, a lot of stretching, and things like that can actually help facilitate the way that the knee can move. So it prevents that shearing and compressive force that actually really starts to hurt the knee.